tell stories about like what life is like to truly grow up in today's day and age. So you can go subscribe to that. Go wherever you get your podcast, type in Processing SWRN, and lock in, subscribe, and get ready for more fun information as we get closer and closer to putting out our first episode. Thank you so much, and keep on keeping on, everybody. All right, ladies and gentlemen, we have two big updates. Number one, we have added a news story about some good news for later in the show, and also a disturbing report coming from the UK. And Prime Minister Boris Johnson is in intensive care now, receiving supplemental oxygen as he battles a coronavirus infection, according to his official spokesperson. Meanwhile, the U.S. Surgeon General says he absolutely expects the death toll to fall short of the projection of 240,000 U.S. fatalities. So that's some good news. But also, Boris Johnson receiving a coronavirus infection, receiving now supplemental oxygen as he battles the coronavirus is pretty crazy here. It is wow. Like, to think the fact that this guy pushing herd immunity, probably the dumbest strategy, bringing people under the most possible exposure to the coronavirus, is now in. And literally bragging about shaking hands with patients with the coronavirus, is in the hospital now, struggling to fight for his, fighting with supplemental oxygen. And that's really all we can say. We can't really speculate about that. Someone call it car bank. Like, if you're putting your people, at risk like that, and this is what happens. I really hate to say it, but you really almost get what's coming to you. Like, the stuff that he has put his people through, and the amount of exposure it's insane. But he has done some pretty good policies in response. I mean, he said the UK said they're going to pay 80% of people's income if they keep their workers hired. So maybe there's that, but like, he's just been really, really ridiculously bad in terms of his initial response. But anyway, we now turn back to what we were talking about before. The U.S. Supreme Court, their conservative majority on Monday night, was accused of greenlighting one of the most brazen acts of voter suppression in modern times after the body overturned a lower court ruling that extended the absentee voting deadline in Wisconsin by 6 days in an effort to allow people to more safely exercise the franchise amid the coronavirus pandemic. In 5-4 decision along party lines, the High Court ruled that Wisconsin voters must hand-deliver absentee ballots by the end of the day Tuesday, or have them postmarked April 7th if their ballot is to be counted. The decision rewards Wisconsin Republicans and GOP groups that led the legal challenge against the extension of absentee voting until April 13th. Matthew DeFore, state politics editor for a local newspaper, noted on Twitter that there is no postmark required during state law, so it's going to count out tons of ballots. This is for the election that supposedly that is happening today. But it is really crazy. There's just like, if you don't have a postmark on it, like, they're literally rewriting state law to suppress the vote here. It is insane. And that shows you, you got people like Kavanaugh out there doing this, and Neil Gorsuch. There's only really one way to say that. All right, so it's really awful. Now we turn to the Sanders campaign. David Sirota, senior advisor and speechwriter for Senator Bernie Sanders' presidential campaign, gave a scathing account on Monday of what he believes to be the driving foes of Medicare for All to embrace universal coverage for the is driving foes of Medicare for All to embrace universal coverage for treatment of COVID-19, dubbed Coronavirus Care for All by the progressive writer. The highly contagious nature of the coronavirus is leading the affluent political class to look at their own interests, wrote Sirota, which is it's definitely true. The wealthy are thus, in this case, backing a healthcare system in which workers are only permitted to get the absolute minimum amount of free healthcare that may prevent them from infecting billionaires. It's really the amount of cynicism that I think is going on here. It just shows you it's like, we will do literally the bare minimum, and we're only doing it so that you don't come in and infect us. Yeah, so this is he did a Facebook post here. Donald Trump, Joe Biden, and the corporate-funded Third Way have all been critics of Medicare for All, but suddenly, all of them now say they support coronavirus care for all. Some of them have asked why they would support universal COVID treatment, but not say universal free universal cancer treatment. The answer is that in a political system owned by billionaires, workers are only permitted to get the absolute minimum of free healthcare that may prevent them from infecting billionaires. Which is, I mean, it's really absolutely right. And so that also, I think, to the other side of it, as Crystal Ball said, that their beloved brunch isn't served with a side of pitchfork from the sick workers who are being forced to push through in these times. So it is really quite, like, that seems to be just about what is going on here. And it's really very disturbing. And they're just living the bare minimum. And they're doing math right now in the halls of power. How little can we give people so that they don't get sick and infect us and make this crisis worse and potentially risk our lives, and so that they don't like go crazy on us here, because it's certainly a possibility. Yeah. So here's some interesting news, folks. I do want to end the show on some good news. It's been less than 2 weeks since New Zealand imposed a coronavirus lockdown so strict that swimming at the beach and hunting in the bushland were banned. They're not essential activities, plus we have been told not to do anything that could divert emergency services resources. People have been walking and biking strictly in their neighborhoods, lining up 6 feet apart outside grocery stores while waiting to go one in, one out, and joining swaths of the world in discovering the vagaries of homeschooling. It took only 10 days for signs that the approach here, elimination rather than containment of the United States and Western countries, is working. The number of cases has fallen for 2 consecutive days, despite a huge increase in testing, with 54 confirmed or probable cases reported this past Tuesday. That means the number of people who have recovered exceeds the number of daily infections. The signs are promising, says Ashley Bloomfield, New Zealand's Director of Health, said on Tuesday. Yeah, so if we look at what it is right now, it's 4:06 a.m. in New Zealand. They already had cases go down, like they had Tuesday, like yesterday. So they've already had their cases go down and improve really drastically. So that is quite crazy. And the signs are promising, says Ashley Bloomfield, New Zealand's Director of General Health. The speedy results have led on calls to ease the lockdown even a little for the 4-day Easter holiday, especially as the summer lingers on, as it is, of course, the summer down there. But Prime Minister Jacinda Ardern is adamant that New Zealand will complete 4 weeks of lockdown, 2 full 4-day incubation cycles before letting up. She has, however, given the Easter Bunny special dispensation to work this weekend in a pretty amusing audio clip that we have to, of course, play for you.
Slightly different note. We've had some correspondence from some younger viewers who are quite concerned this week.
The Easter Bunny?
The Easter Bunny. Have you considered any exemption for the Easter Bunny? Because, of course, it would be breaking the bubble of many families.
Yes, you'll be pleased to know that we do consider both the Tooth Fairy and the Easter Bunny to be essential workers. But as you can imagine at this time, of course, they're going to be potentially quite busy at home with their family as well and their own bunnies. And so I say to the children of New Zealand, if the Easter Bunny doesn't make it to your household, then we have to understand that it's a bit difficult at the moment for the bunny to perhaps get everywhere. But I have a bit of an idea that maybe in lieu of the bunny being able to make it to your home, you can create your own Easter hunt for all the children in your neighbourhood. So if you're one of those homes that's had a teddy in your front window, maybe draw an Easter egg and pop it into your front window and help children in your neighbourhood with their own Easter egg hunt, because the Easter Bunny might not get everywhere this year.
Yeah, so that's obviously some New Zealand slang right now for that last part, but still, it's pretty cool. It is pretty cool to see that. So that begs the question, how has New Zealand controlled the coronavirus outbreak so well and so quickly? Yet it was really, I mean, this is a Washington Post writer just kind of describing this here, named Anna Fifield. When I arrived at New Zealand a month ago, traveling from the epicenter of China via the hotspot of South Korea, I was shocked that officials did not take my temperature at the airport. I was simply told to isolate myself for 14 days. I did. But with the coronavirus tearing through Italy and spreading through the United States, this heavily tourism-reliant country gets about 4 million international visitors each year, almost as many as its total population, did the previously unthinkable. It shut its borders to foreigners on March 19th. 2 days later, Ardern delivered the televised address from her office, the first time since 1982 that an Oval Office-style speech has been given announcing a coronavirus response alert plan involving 4 stages with a full lockdown being on level 4. A group of influential leaders got on the phone the following day to urge her moving to level 4. We were hugely worried about what was happening in Italy and Spain, said Stephen Tyndall, the founder of Warehouse, one of New Zealand's largest retailers. If we didn't shut down quickly enough, the pain was going to go on for a very long time. It was inevitable that we would have to shut down anyway, so we would rather it be sharp and short. On March 23rd, on Monday, Ardern delivered another statement and gave the country 48 hours to prepare for a level 4 lockdown. We currently have 102 cases, she said, but so did Italy once. From that Wednesday night, everyone had to stay home for 4 weeks unless they worked an essential job, such as healthcare, or were going to the supermarket, or exercising near their home. A few hours before midnight, my phone sounded a siren, and as it delivered a text alert, act as if you had COVID-19. This will save lives. Let's all do our bit to unite against COVID-19. From the early stages, our and team has spoken on a simple language. Stay home. Don't have contact with anyone outside your household bubble. Be kind. We're all in this together. So pretty much, basically, to sum it up, what they've done here is act like normal people and see what's happening in other countries. They had the time to prepare. They saw what was happening, trying the devastation that had been caused there, and they're like, let's prepare. And really, the general logic of, we know we're going to have to shut down. We'd rather it be a sharp and short shutdown, and that's what they did here. That's really what they did. So give a lot of credit to them, because they were able to get that done. So shout out to New Zealand for doing a great job there. Maybe I got to move to New Zealand. All right, that's it for us today. We will be back on Thursday with more Newsflash. See you then.